Welcome to OffBlueMedical. Today we're going to discuss core ethical principles and the topic of ethics, professionalism, and legalism. So to get started, ethics is a critical subject for the USMLE. It's very high yield. There is a diversity in questions. There are many broad scenarios which you have to know how to deal with them. And it's challenging since as a doctor, you have to foster the patient relationship. You have to express empathy. You have to build rapport, build the relationship with the patient, and establish professional boundaries with the patient. You have to gather information from the patient using open-ended questions, and you have to also give information correctly. You have to know how to avoid medical jargon. So if a patient has, let's say, a cardiomyopathy, don't say, I'm sorry, you have a cardiomyopathy. You're going to say something like, I'm sorry, you have a problem with your heart muscles, or you have a problem with your heart. You also have to check for the patient's understanding, and you have to do shared decision making. So you have to present options to the patient and discuss with them and come up with a strategy for the intervention that you are presenting. So the first core principle is going to be autonomy, which is the patient's right to choose. So you have to always respect the patient's decision. So if a patient denies a treatment, you don't tell them you're going to die, or you will regret this, or you're making a bad decision, but you could always ask them why. Like, if there was a patient who came in with a medical condition and there's a drug that treats this condition very well, and you say, okay, you need this specific drug, they say, no, I don't want to take this drug. You don't say you'll regret this, or you say this is a very easy condition to treat. You will regret making this decision. You will tell them why. Why are you refusing? Is there anything in mind that you have? Are you planning on taking anything else? So you should always ask them why. So asking why is not something bad, but what's bad is making the patient feel guilty by telling them you will die. So autonomy requires decisional capacity, which we will cover in another video. A pregnant female always has absolute autonomy over her fetus. So for example, if there is a woman who is pregnant and her fetal status is non-reassuring, the doctors then warn her that she needs an imminent or an immediate cesarean section, an intervention, because the fetus will get brain injury, hypoxic brain injury, and she calmly just refuses and says no because she has a deep fear of surgery, and she chooses a vaginal delivery later on because she doesn't want the surgery. Then you should respect the patient's decision. However, the patient has to be oriented and mentally aware of the situation, and has to possess decisional capacity, which we will discuss in a minute. So decisional capacity is an abbreviation for decisional capacity is going to be UEAR. I always use this when I solve questions. It's going to be UEAR. So understanding, expression, appreciation, and reasoning. So understanding is going to be the ability to comprehend the information provided by the clinician. So such as diagnosis, treatment, risks, benefits, and alternatives. So do you understand the condition that you have? Do you understand the treatment? Do you understand the risks, the benefits, the alternatives? Expression is the ability to communicate a clear, stable choice, either verbally, through writing, or through gestures. So when a patient says, okay, I want to do this surgery, this is called expression. Appreciation is that do you believe and relate the information to your own personal situation and condition? We will take an example in a minute. Reasoning is the ability to process and weigh the risks, benefits, and consequences of the options to arrive at a decision. So clearly, we just want to know, does the patient have the ability to know everything about their condition? Do they have a logical reason for their decision? So an example for this is a 35-year-old boxer who has a severe open fracture and is now requiring surgery to prevent permanent loss of function. Then he comes up with a decision and he's alert and refuses surgery, stating that, okay, I'll be fine, I'm a professional boxer, and I heal fast, a little ice and rest, and I'll be back in the ring next week. So here, the patient does have understanding. He understands that he needs surgery, and he has expression because he says, I don't want the surgery, refuses it. But there's no appreciation, there's no reasoning, stating that you heal fast with a little bit of ice and rest and you'll be back in the next week while you clearly need surgery. This means the patient here lacks decisional capacity.
Beneficence?
Which is basically do what's right. And this is superseded by autonomy. So uh, you should always try to do what's right. But if a patient refuses that treatment or intervention that you are wanting to do, then you should respect that. The third is non-maleficence, which is basically do no harm. An example for this is avoiding teratogenic drugs in pregnant women. So the duty to avoid harm overrides the duty to act for the patient's benefit. In another sense, physicians are not obligated to offer treatments that are unnecessary, even if they are requested. So an example is a 35-year-old female who comes down with a common cold. She aggressively demands a prescription for a broad-spectrum antibiotic, stating that, I know I need antibiotics for me to heal fast. Here the physician must refuse the prescription under what principle of ethics? Non-maleficence. The fourth one and the last, let's say primary one, is going to be justice, which is fair allocation of resources and treatment. It has to be fair. So for example, in an emergency care unit, those with the most dangerous conditions get treated first. This is known as triage. There's something interesting and high yield also, which is called the EMTALA, which is the Emergency Medical Treatment and Active Labor Act. It states that patients have the right to emergency care regardless of the ability to pay. You always treat those patients up first. So if a patient comes to the emergency department with a myocardial infarction, even if the patient doesn't have insurance, then you should treat the patient first and then discuss the payment later. Some of the more lesser known principles are going to be veracity, which means honesty, truth telling, and accuracy. Proportionality is important because it means that the benefit must outweigh the harm. So the benefit expected from an action must be equal to or greater than the harm or burden caused by the action. So for example, in a 72-year-old patient who is admitted for severe pneumonia and complicated by acute delirium, who has repeatedly failed verbal de-escalation and safety interventions and is now actively attempting to pull out his essential life-sustaining CVC and oxygen tubing, the clinical decision to apply soft restraints to prevent imminent severe physical harm here is going to be ethically justified by the requirement that the burden of the action be less than the benefit. This is proportionality. So here, a patient is trying to pull out their life-sustaining treatment. So what we're going to do here is that we apply restraints, okay, on the basis that here the benefit by applying restraints is going to exceed the harm by losing the patient's life because they are pulling their life-sustaining central venous catheter. The HIPAA, or better known as the Health Insurance Portability and Accountability Act, abbreviated as HIPAA, means you have to protect the patient's confidentiality on the USMLE. So you cannot expose or access patients' protected health information such as admission, date, discharge, medical records, photos, clinical notes, and any other information unless you have specific permission from the patient. So an example is a nurse looking up a celebrity's medical chart. This is a violation of the HIPAA Act. Another example is a medical staff looking up a patient's phone number from their chart to message them on social media. This is another violation of HIPAA. The last example is physician A, who's treating patient X, actively engages in discussions with patient X's family about his condition without patient X's permission. This is another violation. So, common exceptions to protecting confidentiality is going to be that if the patient is a danger to themselves or others, then you have the duty to warn the victims, the potential victims. You have to always report communicable diseases and the dangerous diseases, and you have to always report child abuse and elder abuse. So we mentioned the Tarasov duty to warn. And this is better known as the Tarasov case, where a patient and the victim, whose name is Tatiana Tarasov, the patient confessed to the therapist his intent to kill the victim, Tatiana Tarasov. Then the doctor attempted to have the patient involuntarily admitted and informed the police of the threat. But the police briefly detained the patient but released him after determining he seemed rational and he promised to stay away. So here, no one warned Tatiana. Here, nobody warned Tatiana. So the patient subsequently found Tatiana and carried out his threat. So Tatiana's parents sued, arguing that therapists and the university were negligent for failing to warn their daughter. So you have to always warn those potential victims and also to call the police.